All right, it is 10:03. So, for the sake of time, we'll go ahead and get started. But welcome everyone, and thank you for joining us for today's community health grand round session, strategies for advancing Black maternal mental health care. So, I'm Stephanie Kennedy, Senior Program Manager at the Louisiana Public Health Institute in New Orleans. But before we get started, please drop your name, organization, and location in the chat if you haven't already. So just a note, there will be time for Q&A at the end of the presentation. So please use the chat or the Q&A function in Zoom if you have any questions for the panelists. I'm also joined by Mignon Holton, LPHI's Family Health Coordinator, who will be monitoring the Q&A and managing our technology today. So here's our agenda for today. I'll share some remarks on behalf of LPHI, and then we'll just spend a few moments grounding our conversation in national data. So providing a brief snapshot of what maternal mental health looks like in the US. And then what we're all waiting for, our panel discussion. So we do have three amazing panelists that you'll hear from today who share their experiences, insight, tools, and strategies to improve mental health care access and delivery for Black mothers. So improving maternal and child health outcomes in Louisiana has long been a priority for LPHI. We can go on to the next slide, Mignon. So we recognize that maternal mental health is not separate from overall health. It's foundational to the well-being of families and communities. We also know that Black mothers experience unique challenges, particularly as we examine disparities in treatment rates. So this reality emphasizes the urgency of this work and the need for culturally responsive and community-driven solutions. So as an organization, LPHI brings deep experience in both behavioral health and maternal health. Our behavioral health team is focused on closing gaps in access to care, especially in the context of the ongoing mental health provider shortage. And we do this by providing tools and training to build community awareness and knowledge on how to identify, understand, and respond to mental health and substance use crises. At the same time, our family health team works with clinical and community-based partners to strengthen systems of care and improve reproductive and maternal health outcomes. So today you will hear from, again, three incredible panelists, one from the LPHI team and two community leaders working on the front lines of maternal mental health. So together, they'll provide an interdisciplinary approach to explore the systemic and cultural barriers that limit access to care. They'll also share insights from their work in the community, and then we'll offer strategies you can take back to your community and highlight actionable next steps to improve Black maternal mental health outcomes. So before we get started and before we move on to the data, I do want to make something clear what this conversation is and then what this conversation is not. So this conversation is not a space to blame or stigmatize Black women, mothers, and families. But this conversation is intended to name the systems and barriers to accessing quality maternal mental health care that are allowing Black women, mothers, and families to fall through the cracks, and to highlight the successes, strategies, and tools to provide the support needed to advance maternal mental health care. This conversation is intended to be a step forward in normalizing discussions about mental health. Reducing stigma is critical for expanding access, increasing utilization, and improving outcomes. All right, so as I mentioned, we can go on to the next slide, y'all. As I mentioned, I want to begin by grounding our conversation with the science, the data, the facts. So what are we seeing in the United States? We're seeing that 1 in 5 mothers experience a maternal mental health condition during pregnancy or postpartum, with postpartum depression alone affecting about 1 in 8 women. And while the CDC recommends routine screening for depression and anxiety during pregnancy and postpartum, it is estimated that about 1 in 5 pregnant women are not asked about depression during prenatal visits. And while this data paints a harsh reality, I guess, my hope is that this conversation and today's panelists will leave us hopeful, engaged, mobilized, and armed with information needed to prioritize Black maternal mental health. So I'd like to introduce our panelists. So I want to welcome Alpha Gebri, Senior Program Manager for Behavioral Health at LPHI, Dr. Artie Brown, Founder and Executive Director of Conscious Moms, an organization dedicated to nurturing maternal mental health by facilitating open dialogue, offering education and providing resources to empower mothers navigating mental health challenges. And by advocating for accessible and effective care, Conscious Moms aims to break the stigma surrounding maternal mental health and strengthen the well-being of both mothers and their children. And finally, licensed certified professional midwife, maternal child community health worker, and doula trainer, Divine Bailey Nicholas, founder and executive director of Community Birth Companion, an organization dedicated to providing mothers with access to doulas, childbirth education, and breastfeeding support. So again, please join me in welcoming our panelists. All right. So again, moving into our discussion. So I grounded us in a little bit of data, but we'll move into some questions for the panelists. So, just a little bit more context. So, Black women, we know, and again, this conversation is focusing on Black maternal mental health care. So, Black women not only face a higher chance of developing perinatal mood disorders during and after pregnancy than white women. So, that's what we're seeing. So, Alpha, I want to turn it over to you. Can you first help ground us in some definitions and context? So, when we say perinatal mood disorders, what are we referring to, and what types of disorders are we seeing?
Yeah,
Yeah.
thank you so much for having me, Stephanie. So when we talking about perinatal mood disorders, we have if we break down the word peri means around birth, so a collection of mental health conditions that occur during pregnancy or up to 1 year postpartum. And I think sometimes people confuse that with perinatal, which is before birth, and refers to during pregnancy, right? So we also have to acknowledge that most people, I think, focus on the fact that it's postpartum and they're expecting things to happen postpartum, but we experience these things throughout the pregnancy, even sometimes prior to pregnancy. So that's also good to put in mind. So these things can look like significant mood swings, anger, irritability, difficulty bonding with your child, with your baby, feeling of shame, guilt, or inadequacy, severe sleep and appetite disturbances, and withdrawing from family and friends. And sometimes people kind of just dismiss these as they're supposed to happen. This is what we're supposed to feel. But we want this conversation to be not around normalizing that in that way, but the normalizing that people go through a collection of mental health conditions. And those can look like bipolar disorders. And then there are other conditions that are exacerbated by bipolar disorder, mania, hypomania, psychosis. They're very far and few in between, but still they happen. And we also have to raise awareness of the fact that these things exist. And traumatic birth and childbirth is also a huge thing, especially for Black mothers. Substance use disorder, and of course, anxiety and depression are things that are under the perinatal mood disorders.
Thank you, Alpha. And it was really interesting that you brought up the experiences of Black mothers, either before pregnancy, during pregnancy, or during childbirth, and even in that postpartum period, that there may be some things that they experience, those mood disorders, but also the birthing experiences or the experiences accessing care that may not be positive, that may
Yep.
be traumatic, can also exacerbate or make worse some of those mood disorders or mental health conditions.
100%. Yes. And even the anxiety going into it, knowing that the system might necessarily not be for you and it might be against you. So then there's all of that that's building up into it too. So yeah.
Absolutely. Thank you for that, Alpha. So again, we know that this is impacting Black women more than others. But what we're also seeing is that Black women are also less likely to seek treatment, even when services are available. So, Dr. Brown, we recently collaborated on a project together. And for those of you who may not know, LPHI houses a program that I manage called the Louisiana Maternal and Infant Data Collaborative. So, the Data Collaborative collects and aggregates maternal and infant data through electronic health record data from some of our hospital systems in the state. So Dr. Brown asked us to look at the number of women who have been screened, diagnosed, and treated for postpartum depression in the state hospital systems. So what we found is that screening of mothers for postpartum depression actually increased from 1/3 of mothers in 2020 to 2/3 in 2024. However, just over a half of those who screened positive for postpartum depression received follow-up treatment. And then 50% of non-Hispanic white women who screened positive for postpartum depression were treated with therapy or medication compared to 48% of non-Hispanic Black women. So again, we're seeing disparities in treatment. So Black women are seeking either treatment with medication or counseling at lower rates than others. So Dr. Brown, what do you think are the barriers that prevent Black women from utilizing postpartum mental health care? And how do you address this in your work with conscious moms?
Well, let's just start with the narrative of a strong Black woman. I think we're all very, very familiar with being a strong Black woman who can do it all. She doesn't need any help. I have this. And if you're not, you're seen as being weak or inadequate. So I think just that stigma right there is just embedded in a Black woman just from history, right? Of being a strong Black woman. So for us to come to somebody and say, I need help is something that you're almost embarrassed to say as a Black woman. So I think that is number one. The biggest thing that Black women face is just being a strong, independent Black woman, and not having to depend on anybody. I can do this no matter if you're falling apart on the inside, but I'm not going to ask you for help. So I think that's the major thing. Next would just be, I mean, there are barriers, just in general, just with stigma. And I feel like it's double with just like being a mom. So I think mental health in general, before you even become a mom and you're feeling this way, you struggle with saying, "Hey, I need to talk to somebody." Because I just feel as a whole in the Black community, especially with church, sometimes it's like pray about it. And God will help you and see you through. And yes, He will. However, we have resources just like we have doctors for our physical body. We have people we can talk to for our mental. So I think that that's very important to go above and beyond to let people know that it's okay that you talk to somebody. So I think those are like the biggest things, just like stigma and being that strong Black woman. Next, of course, we have just providers. So if you're on Medicaid and you are a Black woman, those providers are far and a few in between. So it's just like finding a provider that accepts Medicaid is the starting point. So just because there is a low reimbursement rate for Medicaid and for therapists, for practitioners, just to stay in practice, that is not covering their overhead. So, providing that as a service is really making that practitioner take a hit. So we have that. We have a very low ratio of Medicaid accepting practitioners to our Medicaid mom population. So we have that. We have childcare. So a lot of times if mom wants to come and really focus on her session and not be distracted by her child, she needs somebody to watch her child. It's very hard to I know my daughter right now, she wants to sit with me at church and I'm like, baby, you have to go to children's church because I can't really focus on the sermon when you are distracting me asking me about this or asking me about that. So, for a mom to go to a session and really get the full benefit, she needs to be fully present, and that's hard if they don't have help with the childcare. Transportation, that's another thing. So, getting to your appointments. Now, a lot of therapists do offer virtual, and that is great because that helps to eliminate that barrier. Um, Another thing is Black mothers feeling comfortable enough to go to a practitioner or a therapist without fear of being turned into DCFS, not being, you just reporting them, or whether they're in a situation where there's domestic violence or whatever, just safety wise, like they are protecting, like, yes, I want help, but if I get help, what are the consequences of that? So I think that there are different barriers. And then even if you have a mom who is covered through insurance, sometimes they have high deductibles or high copays. It could be $90 a session. It just kind of depends. And sometimes some therapists are in networks with certain insurances, sometimes they aren't. So you have all these different factors, and just culturally competent or sensitive therapists. So that's another thing. So, you know, we talk about therapists in general, but if you want somebody that like really relates, that you feel like you can trust, then it's finding that culturally competent or culturally sensitive therapist as well. So I feel like we have all those different barriers that that Black mothers face in going out and just receiving that therapy.
You mentioned a couple of things that either we could touch on it now or we could touch on it later because I do want to allow Alpha and Divine to share. But you brought up the church and thinking that mental health is something that we could pray away. Just like God created, depending on what you believe, let's say you believe that God created man, God also created man to help advance, science and everything. So, God will put people in your life or in positions to help. So, we really do have to move past that narrative of we can pray something away. We also can pray and we can go to therapy. We can pray, go to therapy, and take medication if we need to. So that narrative definitely has to change. And I do think that the church plays an important role in that. So thank you for that.
Mhm.
Also, you mentioned something about what people feel like they should be doing as a mother. And, what I've noticed on social media, especially, and like just seeing, different posts about motherhood or things that are going on, there is a narrative of how you should be showing up as a mother. And if you aren't showing up in a certain way, then to your point, you're weak or something is wrong. And that's another narrative that we have to change. Before you're a mother, you're a person. So we
Mhm.
have to acknowledge and incorporate the humanity of mothers more in that
Mhm.
conversation.
Mhm.
So thank you
Agreed.
for that.
Yes.
So, Alpha and Divine, if you all want to share, what do you think is preventing Black women from utilizing postpartum mental health care, or just mental health care in general? And then how do you address this in your work?
So, and this is Divine. Good morning, everyone. As a home birth midwife in private practice, um, I'm in a special space, a unique space with midwifery model of care, in that we're doing home visits. We have more time for our prenatal visits and our postpartum visits. We're seeing moms and clients 24 hours after having their baby, a week after, 2 weeks, 4 weeks, and 6 weeks. So we don't have that gap after they have the baby. And because of this, that we have more time with them, we have the ability to see when things start to divert from the norm, from their normal way of living or have their normal way of adapting throughout that perinatal period. And so in that space, we can pinpoint things earlier and we can refer out quicker. And we have some time because we're seeing them in between that postpartum period, especially, and also having a longer prenatal periods to say, well, hey, did you follow up with? Did you call such and such? I think to your question of this gap between, you know, the screening and then mothers getting care is this a warm referral? Is this somebody that you're referring me to that you trust? And because I trust you, then I'm going to trust this person. So I got to shout out a couple of people, Kramer, Janice, Jasmine Speed of CHI LLC, some Black therapists that are working with moms that folks can feel comfortable with referring to. And then you can say, hey, you're in Baton Rouge, you might want to see Miss Speed. Okay, you're, in the Lafayette area, you might want to see Miss Kramer. She's worked with us, she's come speak, to, Community Birth Companion. We trust her. Here's a warm referral for someone who will work with you. And then also acknowledging that when you hear the price, encouraging moms and their partners to ask the question, hey, is there a payment plan? Are there packages for, for therapy sessions? It's more than one way to skin a cat. Sometimes we see the price, we run away, but also knowing that, hey, I'm getting a referral from someone I respect. and they respect this person, but also knowing that, okay, this person might work with me if they are, maybe doing cash only or not in my network with insurance. So I think being able to really take advantage of the time that we have with our moms to see that something is wrong, refer them early, and then you're constantly doing follow up with, hey, did you touch base with? And I even want to say Saul's Light now has a stillbirth and loss, a virtual support group. So if you're anywhere in Louisiana, you can tap into that. So just letting folks know about what's, provided for them, and knowing like, okay, these are people that we work with and we trust. So if you go with them, they're going to work with you. So
And thank you for that, Divine. And I do want to circle back to your that point in just a second, but I want to give Alpha a chance to respond. How are you addressing lower treatment rates in your work, Alpha?
Sorry, can you repeat that question? You cut off.
Sure. So, what barriers prevent Black women from utilizing postpartum mental health care, and how do you address this in your work?
Yeah. Most of the things mentioned by Artie and Divine, obviously the stigma, lack of awareness, and also like fear of, and financial barriers, of course, but then fear of involvement of child protective services. Income poverty was a significant predictor for CPS amongst white families who were protected by higher income, basically, meaning white families living in poverty were significantly targeted by CPS more than white families and higher tax brackets that protects them. However, the same wasn't true for Black families. Income was not a significant predictor for CPS contacting Black families. They were being contacted regardless of their income. And also, that also goes to healthcare. When you are seeking healthcare, Black families are not receiving the care they deserve, regardless of their socioeconomic status, as opposed to their white counterparts, right? So when you are continuously faced with these type of blatant disparities, it becomes kind of, point like some people are discouraged from seeking services because it's not gonna, we know that it's not for them. It's not gonna benefit them, right? So there is that I want to say um pushback to go and seek services within the healthcare system because of distrust for the system. So that's a big issue. And of course, like the SDOH, the social determinants of health or drivers of health, are also a huge part of why people don't seek treatment. And then for the lack of awareness piece, what we try to do here at LPHI is raise awareness, right? Whether that's through the mental health first aid trainings that we provide, and equipping people with the ability to be able to understand and catch signs early on for us to be able to intervene when before things escalate. So those are the things that we do. Telehealth, access to telehealth and access to care in general is a big issue. So for the telehealth, we've also done some work in advancing racially equitable telehealth here in Louisiana as well as in Mississippi. So those are the type of, improving access to care, raising awareness is something that we do, our team does.
Thanks, Alpha. And I mentioned I wanted to circle back to Divine. So Divine, again, is a midwife and leader of an organization that provides access to doula services and operates out of Opelousas, Louisiana. So you did talk about the benefits of, I guess, midwifery, and a little bit probably touched on doula care as well, that like you're seeing patients at probably, I don't want to say higher rates, but you're seeing patients at different touch points. So you're having more contact with patients sometimes than they're having if they give birth in like the healthcare system or in a hospital system. So you're really making sure that those women are not falling through the cracks and accessing services. But I did want to highlight that since you are in Opelousas, in a more rural area, what strategies do you have to make sure that rural care providers, people living in rural areas, are receiving the care and the treatment that they need. So are there any special considerations for people in more rural areas? Because we tend to focus on our bigger cities like New Orleans and Baton Rouge and Shreveport and Monroe, but there may be some challenges based on where you are. So is there anything you can offer related to that?
Right. So you're bringing up these maternal healthcare deserts, right? So we're seeing that
Hmm.
within the space and realm of, hey, there's no OB or laboring hospitals in certain areas. And then because of that, those women are also not receiving any assessment of care of their needs in the mental health space. So what we're doing is, and what we've been striving to do over time is standing in those gaps in a way of educating our doulas, right? Because regardless, they can travel with a mom or they can navigate the maternal health system with her during pregnancy, whether she's giving birth in the hospital, at home, or in the birth center, right? As support. And a few things we've taken advantage of with Community Birth Companion is prioritizing mental health with our doulas receiving training, receiving mental health first aid training. We took advantage of that's been offered by the National Council of Mental Health. So this treats it mental health similar to how you may be trained for CPR. Like, okay, all of us may not be mental health professionals, but then we can identify signs and symptoms, how to interact, and how to connect the person to a mental health therapist or to a mental health professional. So that's something that we're training. Also, we received training from LDH, who came to speak to our doulas with their PPCL program, which is a provider to provider consultation line. And this is a way where providers can sign up and they have the ability, if they have a client or someone that they're seeing, hey, is exhibiting some signs and symptoms, they got a 24-hour line where they can talk to a mental health professional and say, hey, do we need to take this to another level of care? And PPCL also provides these tele-echo series where you can keep getting training on perinatal mental health and things like that. So we take advantage of that. We're making sure our doulas know about these trainings, have folks speak to us about, like, hey, these are how we can stand in the gaps in spaces where there may not be care, but then identify at a quicker level and refer out and support. I also want to say, let's not forget our folks that's in the gaps in our beauty shop owners, our hair salons, our barber shops, speaking to them, getting some information out to them. Your clients. Did they start losing their hair? Are they talking about being overwhelmed? Because I believe that we should be giving them some mental health first aid training. You know what I'm saying? Or, some pamphlets that they can go and tell their clients to go, hey, you might want to look into that. So we our doulas, at least community birth companion doulas, are community based. So that's why we wanted to make sure that in their working with moms in these different parishes where again they're having gaps, and many times, no matter whether you're a midwife or OB, mamas may feel more comfortable talking to their doula about the different struggles that they're having, and they don't feel judged. So if we're training the doulas and how to identify certain things, we're hoping that that helps connect them to care quicker.
Things Divine, and you brought up a good point. So I heard you mention beauty shops, barber shops. We're talking about churches earlier on in the presentation. I see the conversation happening in the chat, so I'm trying to keep up. But that kind of brings me to my next question about community, but also family. So if we could talk about family for a second. So I know that our focus again is on Black women and mothers, but we also have to make sure that we acknowledge the families and communities in which Black women and mothers exist. So how should we be including family in this conversation about Black maternal mental health? And Dr. Brown, can we start with you on this one?
Definitely just the education piece, the awareness piece. I have
Mhm.
heard from numerous people that a mom will go into a visit, be asked a question, and they will say no, and their partner or family member will be in the room and be like, yeah, you do. So I think that just that education piece, like I said, is very important for them to be aware of what it looks like. Or like if you see this, then it's not okay. Like, it could be signs that, help is needed. So I think just across the board for everybody, just an increase in awareness and education. Because I feel like mental health is just a new space. We just start talking about it kind of COVID and people are just learning about it. And so, going back, I hope nobody felt like the church or, Black people were being bashed and saying that, um, you know, they're not open to it. And I feel like, back then it's all we had. It's all we had to survive. And there was nothing else. And I think it's just a lack of awareness. So it's not that it's just all you know. We know when people get set in their ways and that's what they know, that's what we relied on and look where we are now. So it's not to bash anybody or say anything bad about the church, but recognizing that this is a new layer and this is something else that we can access, much like a doctor that you would go see for your knee or your heart or your back or whatever. We now have somebody that you can go talk to if you are struggling, mentally. So I just wanted to go back and, to that and say that the church is, great, and we just want to add like another piece, another layer to that. And I think that comes through just education and having a conversation, with them and partnering with them, however it may look. But I think it's just a lack of awareness and education.
Yeah, and thank you for that. And maybe we could just spend one more minute on it because, again, echoing that sentiment, that is not to call out, but it's also to kind of call in. And I do think for the church there is a level of accountability. But going back to your point about what role the church has played in our community for hundreds of years, and even like within the last century, is that the church was a place for gathering, the church was a place for education, the church was a place for mobilization to make sure that community had access to the things that we need. So whether that was voting rights, whether that was making sure we had access to the same services. So all of the things that we've seen advancements for the Black community, a lot of that happened within the church, and the church played a significant role. So why not play the same role when we're talking about healthcare access, when we're talking about mental health care access? So not necessarily to blame. So thank you for calling that out so we can clarify. But there is a certain level of accountability that the church holds that it has always held. It's just time for us to shift and pivot and acknowledge that there are new challenges and circumstances in our community that we need to be considering. Um, but also wanted to allow Alpha and Divine to share more about that last question. So, how do we include family in this conversation about Black maternal mental health care? Divine, do you
Yeah.
want to start?
Oh,
Or Alpha? Either one.
okay. I'll just quickly chime in and give it back to you, Divine. I completely agree with all of it, right? Even with the church, I will start with that. There's been evidence-based practices in involving the church and faith-based leaders and change in public health, right? So then that has proven to be effective in HIV care as well and prevention as well. So there's definitely a history of that, to your point, Stephanie. In terms of families, I think there's just a lot of unlearning that we have to do as families, right? Like, and I think sometimes this might be more regional than racial, but it is very much like a lot of unlearning that we have to do. I think our parents and grandparents went through this in silence in the dark and they feel like this is part of being a woman, this is part of being a mother, this is what you go through, and not necessarily acknowledging it as something that can be prevented. No, we don't have to go through this. No, there are, there's a reason why for why we're feeling this way, and there's treatment for this. And I think a lot of mothers don't know that. So when they hear you talk about it, even within the family system, you're just seen as being ungrateful, and that's not something that you're supposed to do as a mother. Or like, it's almost you, yeah, like you're not being a strong woman, right? So going back to what Artie was mentioning too, Dr. Brown was mentioning too. So I think there's just a lot of unlearning that we need to do, and through that is through education, that is through speaking out about it and speaking out about it. And yeah, so I think there is that. And there was one other thing that I was gonna say, but I lost my train of thought. So I was gonna give it to Divine, and then maybe it will come back to me later.
To add on what everyone was saying, I want to maybe expand the word of family, right? To not just be the immediate family. We have to continually educate the immediate family and have them break down the stigma of what they're seeing when they're, socializing and being family like with their, with our expecting families. But Alpha said something earlier about, this is happening to Black women and Black families throughout the socioeconomic span. It doesn't mean that you don't have to be low income. How all of us are dealing with it. We need to tap into our professional organizations. Tap into the Black Nurses Association, the sororities, fraternities, and I say fraternities too because they say with it's 1 in 10 Black men who are also being affected by depression and things of that sort during the perinatal and postpartum period, right? So where are we connecting with them when they have those spaces and they have their conferences every 2-3 years or whatever like that? We need an organization talking about perinatal mental health and mental health period in our professional organizations. For a lot of professional women, that's an extension of their family. Those are people who dropping off gifts and here, here's some food, you were sick or your baby came and this, that, and the other. That's extension. So we have the family that we're born with, but we also want to work out that family. We talked about the community as family with the barbershops and things like that. Again, an extension of family. But in all levels of life, that especially I say for our professional women, sometimes when we're doing community baby showers and things like that, we kind of lean on the free diapers and all of that type of stuff, and then sometimes we're missing out on sisters that's not going to come to that event because they figure, well, I don't want to take no diapers from people that need it. I can buy my diapers. So then she's not getting those pamphlets. She's not getting that information from that vendor who has all the things, right? So how do we tap in and make sure all our mothers are getting this info and their caretakers and sister friends and brother friends are getting that information? And I think we just need to extend the idea of family to those people that are seeing our community in those close family like settings.
I got my thought back, Stephanie. Sorry, I see you off mute. I just got to get it out. I'll make it quick. But I think one of the things that I was talking about our grandparents and great grandparents and what they had, and sometimes suffering in silence. But then I think the other thing that they had was community, right? So I think reinvesting in our community, rebuilding our community is something that is needed for maternal health and mental health in general. I felt like we kind of derived away from that. Our parents had the neighbor coming in and taking care of the child. So when you're not feeling like your best self, then there is somebody taking care of your child. You're not having to get up and do all the things, clean the house, take care of the baby, and while you're dealing with the trauma that you might have experienced in childbirth, even, right? So I think reinvesting in community, finding our community, whether that's in the barbershops or other means, is something that we need to do. That's one of the things that I wanted to add.
Thank you, Alpha. And it just it kind of reminds me of, well, not reminds me because I still feel like we're living in it, but how important it is to build community, but some of just the challenges of building community in 2026 and what we've experienced over the past, 6 years, even if there was already a decline in this idea of community and family in the way that our parents, grandparents, and great grandparents knew it. COVID made it probably 10 times worse. We know that people are experiencing isolation even in, 6 years post-pandemic or 6 years after the onset of the pandemic. Let me say that. So and I know this is kind of a pivot, but like any strategies around this post-pandemic or current pandemic environment that we can share to help build community. Because I think that's like at the core of it. So not even community around maternal mental health or healthcare. How do we just build community in 2026? If anybody wants to drop anything in the chat too, so I'm not sure, but maybe Artie or Divine, like how are you building community with the mothers and the women that you're serving at your organizations?
We're part of the Cafe au Lait infant feeding program, which kind of extends out from birthmark doulas. And we have meetings in New Orleans, Baton Rouge, Lake Charles, and Opelousas. And what we did for this month for our breastfeeding support group, we talked about mental health, and we talked about mental health in a church. So
Hmm.
we were a church opened up their doors for us, and we talked about, because we always extend are for those who are, have had their babies already but are pregnant and that maybe not breastfeeding yet, and having that conversation. So sometimes using support groups that may not be totally geared to mental health, but making sure we take that time out somewhere to check in. We've also had what we call rest days. So we hosted an event in both Opelousas and Baton Rouge where moms brought their sisters and themselves, and we laid yoga mats down, played some music, and we laid back, and for an hour we just rested and didn't say nothing to each other. Just laid back and just rested. Some people cried, some people just laid down, some people wrote in journals, some people fell asleep and was snoring because they did not have no type of sleep like that. And then we had little light bites so they can eat on, and just something simple like that. Didn't ask nothing from nobody, didn't ask nobody to donate, didn't tell them they needed to do nothing, just lay there. And those are ways to build community. Some people that never spoke to each other before, now speak to each other all the time. See each other, say, "Hey, how you doing? How's the children? How the family? How are you?" So just some simple things. It's simple, but sometimes we think it's complex.
I love that. I need to know about the next one, of that rest day. That sounds amazing. To piggyback on what she was saying, I think it takes, I feel like sometimes we put a lot of the burden on the government or agencies and everybody else to do something, and we just need to step up and do something ourselves. So we just need to say, you know what, girls, like let's go, let's start doing something. Like it takes everybody to be a part and to recognize it. And so I say that in saying that if more people, I feel like word of mouth still to this day is the best advertisement that you could possibly get for anything. So I think the more testimonials people share, that helps break down the stigma and helps other people say, you know what? That might be, I need to try that, right? And in this age of social media and everything being viral and things like that, I feel like Divine, if that rest day, however it was marketed or shared, I feel like that would be a thing. I'm starting to see um and I forget what they're called, but instead of having a baby shower, it's like something for the mom. I'm starting to see more of those. So I feel like it's wherever we shift the focus, and it just takes, like I said, I've seen mom walk groups come up. I've seen different things like that. I feel like if people would just start where they are and just try to get together with their friends, with their community, or just start something at their church or start something in their sorority or in their friend group or whatever it may be, I think that just getting the word out and getting more people to bring that awareness. I like how y'all said in the beauty shops, like sharing those resources where people are going to be, where people go, whether it's the daycare, right? Daycare is like number one, because if you're a mom, you have needed daycare. And unless you were fortunate to have somebody, your mom or somebody keep your kid. But I feel like getting more, not reinventing the wheel, but go where people are already going and then get the word out that way and just organically get people to start having conversations and start doing things, and reminder to check in with your friend, like instead of getting her baby clothes for the baby, what about a meal? Like starting that meal train, like starting getting that friend to like start that in the group or whatever it may look like. I think just more of that would help out tremendously.
Yeah, and then just to quickly add to that, on a micro level, um, yes, go out and find these things, but then even like making a promise to yourself that you're going to reach out to one friend, right? Like moving with intentionality. Like one day, this week, I'm going to reach out to one friend that I haven't reached out to just to check on them, just to say hi, just from that perspective. And then one other thing that really stuck with me that one of our colleagues, Fiamela, told me a while ago was always not approaching everything with what can you do for me, but what can I do for you? So within your community, find things that where you can play a role. Like go to these spaces and places where you can play a role where you that gives you self-fulfillment, but also you're also doing something at the same time, right? So then that kind of builds relationships and people would be curious to know what you do, what your initiatives are later, and then that can really, come from it later, but not with that intention, but really truly with the intention of wanting to do something for others. And I think that would slowly build your network. I mean your community.
Yeah. Thank you all for that. And, I think at the core of it, it was really interesting that the common thread between all of your responses was like it could just be something really small as far as reaching out to someone, just a check-in to say, hey, how you're doing, just like taking a nap with someone, picking up the phone. I'll share that I in my friend group or like my group of associates, I'm considered the strong friend. And I had a friend a couple of weeks ago was like, oh, Stephanie's so independent, like she's strong, like she, I don't need to ask her how she's doing. I know she's good. And I had a reaction. I was like, actually, I do need you to check on me. Like, I do need you to call me. I need you to text me. Like, and not even need, it just feels good when somebody picks up the phone and thinks about you to call you and check on you and know that, like, even if you don't need something, if I did, you were there. So something as simple as that, even for the people who we think have it together, are moving along in life fine, but especially for mothers who we know might need some additional support, just something as simple as picking up the phone. I saw somebody talk about a meal train in the chat. If you cooked, put a plate on the side. Cook for me. That's my love language. So, just something as simple as that. It doesn't take a lot. And I think that was the common thread between all of your responses. So I want to save time for Q&A, but I do have one last question for the panelists. So we talked a lot about gaps, and I think this last kind of conversation kind of segues into this. We talked a lot about gaps and areas for improvement, but where are you seeing progress right now as far as maternal mental health? So are there any opportunities that we should be capitalizing on right now? What are we seeing that's working? If you all want to share. Already, I see you on my
Yeah, I was
screen. Go
gonna
ahead.
start first just because I wanted to say something else to that. I feel like individually we have like I think we've all been in a situation where we have seen a mom, whether it's been on a plane, in a grocery store, and she is having a moment with her kids. And I feel like it takes all of us to not to judge moms, not to judge our moms, help. See where we can help, not judge, not just stand there and look, not just shake your head, none of that. Like, help. If you see something happening, or like, well, she should have known that. Like, she knew when she had those other two kids, she couldn't take on another kid. Like, and I feel like we have those internal thoughts or we have those reactions sometimes, and it should not be, because ultimately, they're here now, so that mom needs support not only for her health, but for her child's health too. So I just wanted to add that too, that everybody just has that personal obligation when you do have that, just to change your outlook on how you process whatever you see or experience. Things that I have been seeing going well that I love, like Divine, having our midwives and our doulas with these moms. Like she said, y'all are with them week in and week out. You develop a rapport, so getting them to go seek professional help is much more likely than a mom just giving a card and say, "Hey, you screen positive. Give this office a call and set up your appointment." It's highly more likely with somebody like Divine checking on her mom. Hey, did you set that appointment up? Did you do that? Those models and our community-based organizations that have case managers, like somebody being assigned and responsible and checking in on a mom, has like a higher rate of them seeking and then being retained with those services than just a mom left to herself, to, that's just given a card. And you have to, remember, when you come in, you're getting so much information. It is information overload. So for them to remember to do that is taking a gamble. But if you have somebody like a case manager with a community-based organization, or a midwife or a doula that is following along, or a nurse following along with these moms, I've seen like far better, like I said, outcomes than I see with a mom left to her own devices.
And I'll add to that, just generally speaking, we're seeing more conversation about mental health overall, right? Like people are talking about it openly, a little bit more openly than they did before. So thanks to social media, there's a lot of conversation around mental health, which is great because a lot of folks who end up experiencing postpartum depression have a history of some sort of mental health, right? So like having that conversation early on helps. And I think that be normalized and is a good thing. There is a downside to that too, because you know there are a lot of there's social work experts online that are not necessarily sort of mental health experts. So that's something to be to be on the lookout for. But I feel like having that general conversation is some improvement and way forward, I would think. And I think generally too, there's a growing recognition that maternal mental health must include culturally responsive and community-rooted care. So that is a different perspective than we had before, and I feel like a lot more people are leaning into our midwives and doulas than before.
I can just second that what Alpha was saying. Um, we're talking about it more. And eventually the hope is that the talk will move into action of actually getting care. I saw a therapist, Kramer, have a shirt one day that said prayer and therapy. Okay, so that people that are even in therapy or doing that type of work are saying, "Hey, we can that can coexist." And I think we keep having the conversation in a positive way. Hopefully, that more people will seek care and get good care, because with anything sometimes it takes you one or two therapists to figure out the one that works for you. And I sometimes people don't feel like they have that time, after they've unloaded all their feelings into one, to figure like this person is not going to work out. But we think it's like let me say this. I know for Black folks generally, we don't ask a second opinion in healthcare, period. Right? So then if we're assigned a therapist or, a psychiatric nurse or whatever, and we're not vibing, we don't think, okay, we just think that was something that fell through and we can't go anywhere else because this is how that's going to be with everybody. So the education again has to go, well, that might not have been the best match, but let's go seek someone else. So the conversation is there. We are having great local organizations doing the work, like Dr. Brown's organization, Saul's Light. It's a lot of folks doing that work. But we still have a long ways to go.
And Stephanie, if I can say one more thing, I feel like it's something that we haven't touched just yet that I just thought of, but bias. We deal with a lot of bias. And I feel like that's where the education piece comes in for our school teachers, our OBGYNs, the nurses, the social workers, everything. I feel like as soon as you find out you have a Medicaid mom, there's just this bias that just comes across. People are already going to say they're not going to make their appointments. They don't care, da 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 da. And a lot of times that could be further from the truth. And I dealt with one of my patients, and as a physical therapist, I'm not a mental health therapist, and he was telling me about his wife who's a teacher and how, they had a student and the little girl, they told her that she needed glasses and da 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 da, and the mom's not doing anything and da da da. And I said, a lot of times, especially if it's a single mom, all she hears is, your child needs this, you need to do this. She is doing everything. She shuts down. She shuts down and she disconnects. And it's not that she doesn't care, but if she took on everything, she would break. She would break. And so I was like, it's not all these biases that people have, that's not the case. The mom needs help. These are all signs. And that's why I say, you know, with people that we see, when we see them in public or wherever we meet them, you don't know the full story. So you cannot judge. You don't know what you would do if you walked in that mom's shoes. So before we judge, we need to help. So see what resources that mom needs. She may be like, I don't even know the first step. And then I call these 1-800 numbers, I call this, and they send me here, and then I have to go here. And then it's just like, oh my, and I have all this stuff to do, and she has the weight of everything on her. So I think just more grace, for our moms and just not biasing and just putting them all in this one size fits all, and that is not the case. Just because a mom is not responding to something does not mean that she does not care. She could just be overwhelmed and she has just dissociated. So I just wanted to step in and say that we can get to the Q&A. Sorry.
Yeah, no, that's really important. So before, and we might end up staying over a little bit, y'all, but before that, I just wanted to offer you all an opportunity just to share a call to action because I heard a couple in what you said, Dr. Brown. So a call to action for community to provide more grace for mothers and for parents, and then a call to action probably for like help to some people who employ either therapists, excuse me, or medical providers, maybe some implicit bias training, so that when you have a mom who's on Medicaid or a Black mother who comes in, that you don't make assumptions about the person who's coming into your office or seeking services. Because, and just as an FYI, I can't remember the exact percentage, but it's a little bit over 60%. Most of our pregnancies in Louisiana are covered by Medicaid. So if you are holding that bias about Medicaid covered individuals, then you are potentially having negative impacts, or like the quality of care delivery for so many people is going to be apparent. It's going to be there. Any final calls to action, either by Divine or Alpha? And this could be for anybody, for providers, for hospitals, for community, for churches. We talked a lot about the church today, for families.
I'm going to shoot this out to those who are providers in any way, whether that is doula, community health worker, obstetrician, nurses. Get trained. Get some type of training. Nobody's expecting you to be the therapist. Nobody's going to say, you are having to give them, mental health meds or anything like that. But get trained to know the signs and symptoms. Get trained and make connections across the board. Don't stay in your silos. Get some training and communication across the board to knowing who are our mental health therapists in your parish, in your area, that's working with moms and families across the board, and get to know them professionally. Go to their events, so when you refer out, you can trust that referral, that person is still open, that person is well trained. That is a goal that we all should have and that we need. I know I mentioned the National Council for Mental Well-being that does the mental health first aid training, and also LDH, Louisiana Department of Health, does the Echo series that does pediatric mental health and perinatal mental health. And so reach into those things that you can do virtually on your lunch break or what have you, and have some continued training surrounding mental health.
Thanks, Yvonne. And I see Alpha, excuse me, put in the chat that
Yeah.
her call to action is mental health is health. Alpha, do you want to read it? I'm sorry, sir. I heard you
Yeah,
come off mute.
no, that's fine. Yeah,
Okay.
mental health is health. It should be prioritized and as important as our physical health. We are whole beings. We're not one or the other. We're, our environments are where we are. Our mental health, our physical health affects us all and makes up the whole us. So I think it should be prioritized. That's more for from the policy perspective. But for us, like Divine was saying, so we can show up better for our community. I think some of us that were raised in tough love kind of environments, we need to unlearn some of those things. And I think mental health first aid does a good job of that, being able to allow us to show up for our neighbors, our friends, and our coworkers.
Thanks, Alpha. And I know we're over, but maybe if we could just take maybe two questions. I see a couple of questions in the chat about screening. So the last question was based on the current screening tools that are being used. Is there a culturally contextualized diagnostic questionnaire that can be used for mental health. I know there was an earlier question as well about is there a push for increased screening? So can anybody speak to if there's anything that is culturally contextualized or culturally appropriate and developed, and if there is a push for increased screening right now?
There's a push for increased screening where we are actually encouraged to screen prenatally and postpartum across the board. Generally, we're still using that Edinburgh depression screening. So I would love to know too. I know the national organization I want to say it's Shades of Blue Project has a training for Black maternal mental health. They're also the host of the Black Maternal Mental Health Week, and they initiated that. I'm wondering if that may be a resource we can look into to see if they have their own screening process. But the one I know that's used pretty much across the board is the Edinburgh.
Ari or Alpha, any thoughts on that question about screening?
So, and I know we have other healthcare professionals. Like I said before, I'm not a maternal mental health therapist. However, it is a requirement of OBGYNs and pediatricians to screen our moms, and they are using the Edinburgh. And there is like a billable ICD code that is attached to that so that, providers, they were before it was like, well, we're not doing it. We're not getting paid for it. Like that's just extra work. So they did, provide like an ICD code for them to bill with. So hopefully, and like you showed with what we did with LPHI and the data we had, that it went from 1/3 to 2/3. So we still have more room to move the needle because that's just about 66%. So we still have, almost that 40% to go. We're like right over the half mark. So hopefully, the OBGYNs and pediatricians are doing their due diligence in screening our moms.
Thanks for that, and thank you, Charlotte. I see the clarification on the question. The first question was, is there a push for changing the current screening tools that are being used? And I think you all kind of touched on that a little bit, that right now they're using the Edinburgh scale, but
Mhm.
I mean, there may be some other trainings, but not sure if there's a push for anything else to be used right now.
Yeah, and then I go back to the what next, right? So like, yes, there is an
Mhm.
increase in screening, but then what is being done after that? Are they getting the necessary help after
Mhm.
that? But I don't want to end this in doom and gloom. I feel like the increase does then help us kind of show to policymakers there is this increased demand for it, and then we need to do something about it now. So I'm very happy to see the increase, and hopefully then that would result in some sort of action, like Divine is saying, and being able to get more mental health professionals on the ground for people to be able to receive help.
Mhm.
And let me just read this one last question. I'm not sure if we're going to have an answer for it, or this might be something that we need to think about and strategize more. But to that point, um, someone put in the Q&A, from a health plan perspective, we face significant challenges identifying our Medicaid pregnant members due to some of the barriers that were mentioned today during the panel, and also because either the providers and or the members, so we're talking about the people who are covered by Medicaid, don't report pregnancy to the insurance companies. So they mentioned that they do have a notice of pregnancy form and offer their members incentives for reporting their pregnancies. So they asked if we had any recommendations for how to meet these members where they are to help increase reporting. So like, how do the health plans, the insurance companies meet members where they are to learn that they are pregnant so that they can get the information out to those people about the services that are covered. Like, it could be mental health services, it could be doula services, it could be any of these services that fill in some of the gaps that we talked about today. So, again, not sure if we have any immediate reactions to that, but it kind of touched on the conversation that we're having. So I wanted to acknowledge that question, and see if anybody had any thoughts about that.
I guess I have more follow-up questions with that. So are they not seeking any prenatal care when they do have the baby? Or they go like what's happening there? They're just not coming in at all. They're having the babies at
Mhm.
home on their own, or what does that look like for that question? Are we trying to push for them to come in earlier? Um,
Mhm.
or what?
Yeah, and that context isn't included in the question.
Right.
So again, this
Same.
it
That
might
was
be a
my
little bit of
question too. Like, soon
yeah,
as they should, I'm thinking from my perspective, when they go to their first prenatal visit and they're, they've had, ultrasound and everything, and it's a positive pregnancy test, then I'm thinking the OB or nurse is
right,
billing,
right,
and that should signal to the
Right.
Medicaid. So
yes,
is there a
Right.
processes,
yes,
or
Right.
is these people that are not seeking any prenatal care?
Right. Right.
yes. That's important because again, there should be some communication between the hospital or the provider and then the insurance company as well. So,
Mhm.
not sure if there's a limitation or a barrier there, or maybe an opportunity for improved collaboration or communication between providers and
Mhm.
health providers, but or insurance providers. So maybe that's an opportunity there. But to your point, there may be some people who, again, aren't seeking that traditional care as soon as they receive a positive pregnancy test, or maybe there's some sort of gap there, so we don't know. That context wasn't provided, but to the point of like, if you go to the doctor in a traditional clinic or hospital setting and there's a positive pregnancy test, there should be some sort of communication automatically. And if there
Mhm.
isn't, then how can insurance providers and hospital systems or clinic
Set
systems
your
work
table
better
up at the
together?
free diaper places. Make sure that you all
Hmm.
always have a table at the community baby showers. Make sure that maybe you have once a month
Hmm.
somebody has a table at the breastfeeding support groups or something like that. That you may have somebody who is a member of your MCO that is going to go ahead and say, "Oh yeah, I'm pregnant," and so because they're seeing you there. So make sure that you all have kind of boots on the ground in those community spaces where Medicaid members are going while pregnant to receive community resources, that they can also see you there as well.
Yeah. And one other thing that I like had on in my notes that we didn't get to was that starting where the people are, right? Like understanding why people do the things they do, why people make the choices they make, right? So I think in the data that we talked about, Stephanie, when we first started this, I read somewhere that more people are opting not to go to more pregnant people are opting not to go to getting medical care in the past 2 to 3 years. So even some of the data is missing out on those people that are opting
Right.
out of care. But why are those people opting out of care? So understanding that first, and then like working towards the solution. But yeah, that's the only thought that I had when I first heard that.
All right, y'all. I realize that it is 10 past the hour, so I do want to wrap us up. Thanks again to our panelists, Alpha, Divine, Artie, for being a part of today's discussion and providing valuable insight and actionable steps. So we do have an evaluation for you all. So if you could either scan the QR code, or we'll be sending out a follow-up email with resources, as well as the link to the evaluation. Very brief survey. We just want to hear your feedback about today's session and about how we can improve for future grand round sessions. So please complete the evaluation survey. We put it in the chat, but just a plug. Artie is having an event this Saturday, Miles to Mom in Baton Rouge. We put the flyer in the chat. So if anyone is able to attend, please do so and support Conscious Moms in Baton Rouge. Anything else, guys, before we end? If there's any questions, you all can contact me or Mignon related to grand rounds in general, but anything else from our panelists?
Just thank you for allowing us the opportunity to have this panel, to have this discussion, to see where, the participants are seeing gaps or having questions, and learning from the other panelists on this call. So just thank you to everybody that's here.
Thanks,
Excellent job,
everyone.
Brown.
Enjoy the rest of your day.
Yeah.
Thank you.
All right. Bye, everyone.
Bye.